In this Get Pregnant Now Quickie, we're going to discuss your vaginal microbiome and how it could be silently sabotaging your ability to conceive and increase your risk for miscarriage. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In today's episode, we're talking about something that's rarely discussed at your doctor's office, or in the least, it's not comprehensively reviewed and addressed. Yet, it can make or break your fertility, and that's the vaginal microbiome. So today we're going to talk about why an imbalanced vaginal microbiome can prevent sperm from surviving long enough to reach the egg, how harmful bacteria or yeast can increase your risk of implantation failure and miscarriage, and natural steps you can take to restore and protect a healthy microbiome for conception. So when most people think about fertility, they focus on hormones, ovulation, sperm health, or maybe the uterine lining. But here's the thing. The vaginal microbiome is like the security gate for your reproductive tract. If the gate is unbalanced or inflamed, the journey to conception can be sabotaged before it even begins. What exactly is the vaginal microbiome? It's a community of bacteria and microorganisms that live in the vagina. In a healthy state, this microbiome is dominated by the lactobacillus species, which keep the vaginal pH slightly acidic, creating an environment where healthy sperm can survive and pathogens are kept in check. But here's where the problem lies. When the microbiome becomes imbalanced, a condition sometimes called dysbiosis, harmful bacteria or yeast can begin to take over and overgrow. And this can happen due to previous antibiotic use, chronic stress, high sugar diets, hormonal changes, overuse of scented products, douches, or harsh soaps in that sensitive area, and frequent unprotected sex, potentially with multiple partners, without giving the microbiome time to recover. So why does this matter for fertility? An unhealthy vaginal microbiome can damage the sperm before they even have a chance to reach the cervix. It can trigger inflammation that makes implantation less likely. It can increase the risk of early miscarriage, and it can raise susceptibility to infections like bacterial vaginosis, also known as BV, or yeast overgrowth, both linked to poor fertility outcomes. Research has shown that women with certain microbiome imbalances have lower IVF success rates and higher miscarriage rates. And this is because the vaginal environment is directly connected to the uterine environment. And if the quote unquote gate is inflamed or imbalanced, then the uterus often is too. And I do want to make a note here. You don't have to have symptoms or be symptomatic to have an infection or to have an imbalance. The imbalance could be present and you could have no symptoms at all. So don't think that you're in the clear just because you don't have any symptoms, because honestly, the majority of my clients who have this test done, they don't have any symptoms and they have dysbiosis. So what can you do? Get tested. We have such easy access to at-home vaginal microbiome testing that can identify imbalances and pathogens that are present. You can support your microbiome naturally with a whole food diet, probiotic-rich foods like unsweetened yogurt and kefir, and proper hydration. We want to avoid unnecessary antibiotics and vaginal products that can disrupt the pH, wearing breathable cotton underwear, and avoid staying in damp workout clothes or bathing suits. We also want to avoid highly processed foods and sugary foods as well, because sugar is going to feed any yeast that could be present. And you want to work with a fertility practitioner who is an expert at addressing these chronic infections or inflammation. Bottom line, not looking into the vaginal microbiome is potentially planting a seed in poor soil. The conditions simply aren't ideal for new life to thrive. And by restoring your balance, you're creating a welcoming, healthy, nourishing environment for sperm, a receptive uterus, and ultimately a healthy pregnancy. So let's recap. Your vaginal microbiome plays a very critical role in the survival of sperm, implantation, and miscarriage prevention. Having an imbalance can come from antibiotics, stress, diet, or harsh products, and it can sabotage your conception efforts without you even realizing. Proper testing, diet, lifestyle, and targeted treatment can help restore a healthy, sperm-friendly, implantation-ready environment. So if you've been struggling to conceive or have had early miscarriages without any explanation, this might be one of your missing puzzle pieces. If you want to learn more about the test I use with all of my clients, whether they have symptoms or not, DM me on Instagram at @the_wellness_pharmacist and mention episode number 147. Thank you so much for listening. I hope you have a beautiful day, and I'll see you on our next episode released every Tuesday and Thursday. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.